Welcome to the online demonstration of coronary CT angiography. What is coronary CT angiography, or CCTA? Coronary CT angiography, CCTA, is a special study that provides high-resolution pictures of the coronary arteries. This quick outpatient study can show if there are blockages to blood flow in the arteries caused by plaques. This exam demonstrates coronary artery disease even when the coronary arteries are less than 50% narrowed. Routine cardiac tests will not reliably detect this level of blockage. CCTA shows hard, calcified, and soft, non-calcified plaques and narrowing of the arteries. More than half of all heart attacks occur with less than 50% narrowing. Early detection could save your life. Let us tell you more about how you might prevent coronary artery disease or even a heart attack. CCTA may include coronary calcium scores, or you can have only your calcium score performed. Calcium scoring with CT gives information about the location and extent of calcified plaque in the coronary arteries. The amount of calcification, expressed as a score, may help to predict the likelihood of a heart attack in the coming years. CT for calcium scoring takes little time and causes no pain. In addition, this exam does not require an injection of contrast material. A negative CT scan showing no calcification suggests that plaque is minimal and that the chance of coronary artery disease developing over the next 2 to 5 years is low. A positive test means that coronary artery disease is present even if you have no symptoms. What are the limitations of having only the calcium scoring exam done and not a full CCTA study? CT for calcium scoring does not measure non-calcified plaques, nor the degree of narrowing in the arteries. In addition, not all plaques contain calcium. Based on the outcome of your studies, you and your doctor can determine what sort of intervention is needed, if any. Oftentimes, medication or lifestyle changes are suggested. Is CCTA a substitute for a conventional angiogram? CCTA offers excellent imaging of the coronary vessels and in some ways is superior to conventional angiography. However, if there is a high likelihood of significant coronary disease based on history and clinical findings, conventional angiography may often be a better choice. This is particularly true for patients with acute chest pain and for those who are likely to need angioplasty or stent placement. CCTA is not a substitute or replacement for a conventional angiogram. CCTA is typically used for the early detection of coronary artery disease. How do you know if you might benefit from a CCTA? Patients at increased risk for coronary artery disease have known cardiac risk factors, particularly if there is also a history of chest pain or exercise-induced shortness of breath. Risk factors include family history of early, before age 50, heart attack or stroke, smoking, diabetes, high blood pressure, and other cholesterol abnormalities. If you have one or more of these risk factors, please ask your primary care provider if CCTA would be useful in managing your cardiac health. CCTA isn't for everyone. If you have an irregular heartbeat, pacemakers or implantable defibrillators, severe asthma or other lung problems, kidney problems, known extensive coronary calcium, or are pregnant or morbidly obese, this test isn't for you. Preparation. Before the study is performed, patients are given a common blood pressure medication that also lowers the heart rate so the small coronary arteries can be seen better with less rapid movement. There are also dietary and medication restrictions for the day prior to the exam. A complete set of instructions would be given to you at the time of scheduling. What should you expect during the exam? CCTA is performed with a rapid 64-channel CT scanner. A computer-operated table slides the patient into the middle of the CT scanner, while the scanner takes pictures of the heart from 360 degrees. Prior to the scan, an IV is placed in the arm in front of the elbow. 4 EKG leads are attached to the patient's chest, so pictures can be captured in sync with the heart rate. The patient receives both oxygen and a single spray of nitroglycerin under the tongue to dilate the arteries just before the procedure. Imaging takes place during IV injection of contrast material, X-ray dye. The patient is instructed to hold their breath for 7 to 10 seconds during imaging. The actual time on the imaging table is about 15 minutes. Care after the exam. After imaging, the patient can return to their usual daily routine and diet immediately. There is no recovery time. Getting your results. Valley Radiologists is pleased to work with Valley Medical Center and South Lake Clinic cardiologists. Our team of CT physician specialists, made up of radiologists and cardiologists, will review your study, and a report will be sent to the referring physician detailing the findings and recommendations. Patients may also request a time to go over their study with one of our coronary CT physicians. CCTA and CT for calcium scoring is performed at Valley Diagnostic Imaging Services Olympic Building. The center is located on the Valley Medical Center campus in Renton. Please call us toll-free at 1-877-674-2674 if you have further questions or would like scheduling information about CCTA. We look forward to serving you and your physician with the best in service and imaging. Welcome to the online demonstration of coronary